I'm Stephanie with 9 Health, and this is Health Happens, our show we do every Tuesday to bring you objective, real health information. We're talking about Breast Cancer Awareness Month, and today we're talking about the standard of care, prevention, treatment. This is Dr. Joyce Moore. She's at Skyridge Medical Center. We're going to talk with her in just a moment. But again, Breast Cancer Awareness Month, we've been talking about it all October. We're following the journey of one physician and professor, her breast cancer journey, and that's on our blog. You can also find it on our Facebook page, and kind of just the treatment she's gone through and everything that she's gone through with her experience. And last week we talked about a breast cancer diagnosis and how it affects your mental health. That was a great segment, and again on our Facebook page and also on our blog, so check that out. But Dr. Joyce Moore is joining us, and today we're talking about standard of care, prevention, treatment. Many deaths could be prevented if, all women got the prevention and standard of care that they needed to get or supposed to get. So we're going to touch on that a little bit, but first, kind of just talk to us about what the standard of care for treatment and prevention is. Like, what does that really mean?
Yeah, I guess standard of care for prevention is what can we do in our lives and what do we have control over that we can do that can lower our risk for breast cancer. And some of the things we can do are dietary habits, like eating a plant-based diet instead of an animal-based diet. It's not that you can never eat meat or anything that's animal-based, but it's much better if most of your diet is plant-based proteins, and it can help prevent. The other thing that's important is keeping our weight down into a normal level. Our BMI is in the normal range. So however you have to do that, whether it's diet or exercise,
right?
Exercise is important as well. Studies show even independent of keeping the weight down and stuff, exercise can lower your risk for cancer, and it decreases your stress levels. Because that's another thing you can do to kind of lower your risk, keep your immune system healthy, is to decrease your stress levels. How can you do that? Social interaction, exercise or activity, volunteering, like at the 9 Health Fair.
Right, yes, at the 9 Health Fair.
And seriously, people who volunteer, it's been shown that those studies that they
we've
actually
talked
are
about
healthier.
benefits of volunteering before.
It is. Yeah, it's a real phenomenon. But those kind of things in your lifestyle you can do. The other important thing is alcohol. Alcohol is pretty pervasive in our society, but keeping your alcohol intake low. It's recommended that a woman keep her alcohol intake to 1 drink or the equivalent per day, or less.
Right.
No alcohol at all is fine. There's no reason you have to drink alcohol.
Right.
But keeping it low is better.
Right.
So other health habits is just keep your immune system healthy. Or don't smoke. That's always good. Avoid, if you can, environmental contaminants in ways that you don't want to be in smoke-filled areas. So even if you're not a smoker, being around secondhand smoke and stuff like that, those are the things we can do. From a medical standpoint, what can we do to reduce risk and prevent breast cancer? There are medical things we can do.
Right.
We can give hormone blocking agents like tamoxifen, which is a medication that can lower a woman's risk for breast cancer.
Would you just give that to someone that has like a family history?
That's right. For someone who we consider high risk, and defining high risk as patient with a family history, patient who's had a certain type of biopsy, like atypia on a biopsy, those women are higher risk for getting breast cancer than the average population, and one of the options they can pursue is to take tamoxifen, which can lower their risk. Okay. So those are the things we do for prevention. I think, too, it's kind of prevention, but it's more early detection, Getting your mammograms. Women should start to get their mammograms at the age of 40, right?
Just the average risk woman, age of 40.
And that's a good point too, a high risk patient. So if someone has a family history where one of the women in their family had breast cancer at a young age, we generally recommend starting 10 years prior to that age. So if a woman had breast cancer at the age of, say, 48, we'd recommend starting at 38 in, their daughters or their sisters or whatever.
Right.
Okay? But yearly, starting at the age of 40 is what we usually recommend. There's no hard and fast rules as in you have to get it yearly, but all of us in the breast community really believe that's the right way to go because you catch things earlier.
Right.
Starting at the age of 40 and then continuing on until your life expectancy is such that you wouldn't be able to treat your breast cancer anyway.
Okay.
So if you're 95 and healthy, get your mammogram.
And it's annual, every year.
Every year, yes, because we catch things earlier that way. And it's worth it. I mean, patients would much rather catch something earlier, not have to undergo extensive treatments like chemotherapy, potentially avoid that by catching it early, than skipping, doing it every other year. For many patients, they'd much rather do mammograms every year than have to undergo more extensive treatments.
Right.
So catching things early is sort of a prevention. It's let's prevent additional treatments if we can, by catching things early. So getting the mammograms, paying attention to your breasts. Paying attention to your breasts is one of the best things you can do. If something changes, whether that's a nipple discharge, a skin lesion, something you feel, or you're just like, I'm not sure. This just doesn't seem right to me. Go in or come in and see us, because what we'll do is we'll work it out. And I sure like having that conversation with a patient of, boy, this is great. It's benign and you don't have to worry. And aren't we happy? Rather than, ooh, I wish it hadn't waited. So come on in. You know, that's one of the best things people can do.
Right. So again, it's Breast Cancer Awareness Month. We're talking about standard of care for prevention and treatment with Dr. Joyce Moore. She's a breast surgeon here at Skyridge Medical Center. If you have any questions, you can post them in the feed. We'll get those answered for you. But let's just kind of continue on. So we're talking about standard of care, treatment, prevention. As a breast surgeon, explain the typical surgical treatments that someone would receive if they are diagnosed with breast cancer. What does that, the start of that journey look like?
Two basic ways. When someone's first diagnosed with breast cancer, we want to gather information so we treat properly. Because if someone needs chemotherapy prior to surgery, we want to initiate that and then do surgery. If someone needs surgery first, we want to do that. So we gather information. What are the tumor characteristics? How big is the tumor? We also like to do genetic testing because that can change surgical options. So we first gather information. Then once we have our diagnosis, we've gathered our information, the standard surgical treatment options are lumpectomy or breast conservation. That's where the breast is left in place, but we take the tumor out, and then radiation usually follows after surgery. Women have to have a small enough tumor. They can't have multiple tumors in their breast if they're going to qualify for breast conservation. The second option is mastectomy, which is removal of the entire breast tissue, leaving behind skin, which can then be used for reconstruction if a woman wants reconstruction.
Right.
Again, that's a personal choice. Some women do, some women don't. But anybody can have a mastectomy. Generally speaking as well, we do lymph nodes. We want to know, are lymph nodes involved? So if we don't know that based on imaging prior to surgery, then we'll do what's called a sentinel lymph node biopsy. Sentinel lymph node biopsy is the standard of care now, minimally invasive in the sense that we take fewer lymph nodes. If those lymph nodes are clear of cancer, we don't have to take extra lymph nodes. So everybody should be getting a sentinel lymph node biopsy.
And that would be during that first
That's
breast
during
cancer.
surgery. Breast cancer surgery, yeah. If we know you have a positive lymph node, you don't necessarily have to have a sentinel lymph node, but because then we would do an absolute resection. But, so lumpectomy and mastectomy are the basic kinds. Bilateral mastectomy is a choice women need to be aware of too. Women who carry a genetic risk for breast cancer, their risk being very high in their lifetime, may choose to remove both their breasts to lower their risk. That's another thing that can be done to lower risk. So not only taking tamoxifen, as we talked about for high-risk patients, but removal of the breast tissue is another option to lower risk as well.
Risk of recurrence or anything coming back.
Yeah, it lowers your chance of breast cancer in the future. But lumpectomy versus mastectomy, if a woman meets the criteria for lumpectomy and she's a good candidate for lumpectomy, survival's the same for those two patients. So patients don't have to be scared that, oh my gosh, if I get a breast cancer diagnosis, I'm going to have to have a mastectomy because
Dr. Moore's going to get called.
Sorry guys, we'll just shove it under there. It's nothing important. We can. So if they don't have to be terrified that, oh my gosh, a breast cancer diagnosis absolutely means that I have to have a mastectomy. That's not always the case. Lumpectomy can be done. Even patients who start out on this journey where it looks like they might need a mastectomy because their tumor is large, chemotherapy can often shrink the tumor down to a size where you can actually proceed with
And that would be getting chemo beforehand.
Chemo before surgery. Yeah.
Do you have a question?
No, just a comment. We just need to speak up a little bit louder.
Okay.
Oh, sorry.
We can speak up.
We'll speak up.
And so again, with Dr. Joyce Moore, we're Skyridge Medical Center. She's a breast surgeon. We're talking about standard of care for treatment and prevention of breast cancer, reducing your risk for breast cancer, and why some women maybe aren't getting that standard of care. But we're talking specifically right now about typical surgeries. I wanted to ask you, because you have something here at Skyridge, you do hidden scar breast cancer surgery. So tell me what that is.
So the hidden scar, the concept with hidden scar is how can we make the visual impact of surgery less for a patient? And there are various ways to do that. With mastectomies, nowadays we're doing nipple-sparing mastectomies too, which is really nice for the patient because the nipple is spared not because it has sensation or because you can produce milk, because when the breast is gone you can't, but because it looks good. It looks like their nipple. And those scars would tuck down under here, so when you look at the patient face on, you don't see scars. So they're tucked up in ways that you can't see them. We do the same thing with lumpectomies. We try and put the scars around the edge of the areolas where they aren't seen because the color change between the areola and the skin hides those scars and they aren't as apparent. Or we try and tuck the scars in areas where they're not as visually apparent. Because when a patient looks at themselves in the mirror and they say, I can't even see my scar, that's a really big emotional impact. It's nice for the patient.
Last week we talked about mental health and cancer diagnosis, and you wouldn't think, you just think, I want to be healthy, I want to survive, but at the same time, especially with breast cancer, there is that physical part of it where you just want to kind of look like yourself still.
Exactly, and I think that's exactly how we approach it. First and foremost on our list is let's get rid of the cancer. Let's treat the cancer, get rid of that thing. But high up on that list is, now we know how to do that. Let's make it the least impactful that we can for the patient.
Right.
You know?
Yeah, so very cool. So what are some barriers that women might face that would keep them from getting standard of care treatments, standard of care prevention? Like,
Yeah.
let's talk just a little bit about that.
That's very important, actually. And I think some of the things we see, especially in Colorado, is people live in rural areas, so it's hard for them to get in and access things like mammograms or standard, high quality treatments because they just aren't close to that. So it's
Yeah.
a journey for them. So they oftentimes will say, it's hard to go. I'll skip it this year or the year after. Some of it is a knowledge deficit. Some patients don't realize I'm supposed to get mammograms every year, or I'm supposed to do this, that, or the thing, or if I find something, go in and see my doctor. That's why this kind of stuff is very helpful to get the word out to
Yeah.
patients. Because if patients don't have a primary care physician, they don't know sometimes, and nobody pushes them to go and do those kind of things.
Right, they don't know the age they're supposed to start or what they're supposed to be doing.
Exactly. Financial resources, economic issues are probably one of the biggest ones. For those patients who don't have insurance, they're afraid to go in. They're afraid about the cost.
Yeah.
They don't want to pay for that if there's going to mean skimping on something else for their family or for them.
Yeah.
And I think people need to realize there are resources out there to help them. Various organizations, American Cancer Society can help with some of that. Susan Komen Foundation can help with that. But there are resources out there.
Yeah.
So basically making contact with the institutions that provide screening, because that's how it first gets diagnosed, and then with primary care providers so that they can get in, and on a regular basis and get these screenings done. And then access as far as getting outreach programs into rural areas so patients have access to that kind of thing.
Yeah.
Those
And
are
then
probably
at the
things.
Nine Health Fair this fall, you can get a free breast screening at most locations. It's not a mammogram, but a free breast screening. It's at least a start, and then you can follow up with a physician. Or if you don't have insurance, you need a physician. We can always help you find a physician as well. We talked a little bit about resources, and those are also available to you as well.
I think swinging around on that loop about the mental health from last
Right.
week, some women are scared. They're afraid.
Yeah.
It's like, I don't want to get
Which
that
we
diagnosis.
see a lot just in preventive medicine anyway. Like you don't want to find out.
Yeah, you don't want to. Yeah, so I think overcoming that fear is one of the barriers too. Just get in and get it done because patients need to know that it's curable. Breast cancer is treatable and curable. Even if we can't cure it, we can usually control it with good quality medications and treatments that they can have good quality life too.
Yeah, it's much
So
different than
it's-
it used to be. I feel
Oh,
like.
much
It's a
different.
Much different diagnosis. Still not something you want to have, but
Exactly.
so for someone that's starting as their breast cancer journey and as a breast surgeon, what is something you wish? We've talked about prevention and how important that is, but what is something you do wish that someone new that is newly diagnosed? It's hard for me to get out.
I think that what we just talked about is probably the most important thing I'd like to communicate to patients as they start their journey. It's like to try and get rid of the fear. I can't tell you how many times patients come in my office and they are just terrified that they're going to be told I need mastectomies or the chemotherapies are so tough I won't. They need to know it's curable, it's treatable, and usually the treatments that we use don't have to be devastating and change their life. They can recover from them and live their lives and go onwards. I think that keeps a lot of people away until it's advanced and treatments need to be more. So I think if I could say to every woman out there, don't be afraid. It's hard to say that, but don't be afraid. It's hard for them to feel, but come in. We'll take care of it. We got you.
Better sooner than later.
We
It's
got
not
you.
gonna go
That's
away.
right.
If you
That's
have it,
right.
it's not gonna go away without any help. So, is there anything else that you wanted to add that we didn't touch on today? Again, this is Dr. Joyce Moore. She's a breast surgeon at Skyers Medical Center. If you have any questions, you can post those. We can get them answered for you now or later as well. So,
I think just encouraging all women to pay attention to your breasts. All women, young women, starting when you're in your teens all the way up till you're a granny. Just pay attention to your breasts. If something changes, it's new, you're not certain, come in. We'll help you find resources. Somehow we'll find those resources to get the treatment that they need. But don't ignore your breasts.
Yes.
They're important.
and it's good we're talking about it.
That's right.
Again, October. We have a question?
Not a question, just a comment from Adrian. Dr. Moore was my doctor. I had surgery on February of 2012. 7.5 years cancer-free. Hi, Dr. Moore.
Hi, Adrian.
And that's awesome that Adrian's cancer-free. Good.
Yes. Love that.
Love hearing those stories.
Yes.
All right, so we're going to sign off from here now. But if you have any questions or comments, you can post those, and we'll get those answered or pass those along for you. Again, it's Breast Cancer Awareness Month, all October. That's what we're talking about. Next week, we're going to talk to a nutritionist who's going to give us some good recipes for breast cancer, reducing your risk for breast cancer. But then also, if you are diagnosed with breast cancer, something good that might taste good, because a lot of times those treatments can cause nausea and things might not taste as like they used to. So some recipes to go along with that. And again, go to 9healthfair.org. You can find a fall 9 Health Fair near you and get a free breast cancer screening or other preventive screenings. And yeah, that's pretty much it. Thanks for joining us.